Hello, Dr. Berg here. I'm going to talk about diagnosing diabetes. Of course, I'm not telling you that you should go out and diagnose diabetes, but if you wanted some information on some of the values, blood test to determine diabetes, that's what I'm going to talk about. Number one, I'm going to show you the values of the American Diabetes Association, okay? The same organization that recommends 40 to 60% of your calories should be carbohydrates. All right, which I disagree with, okay? So do a fasting glucose test. 126 is the cutoff point that you have diabetes, okay? If your blood sugars are 126 or greater, you have diabetes. Okay, if it's 100 to 125, you have insulin resistance, which is the precursor, the thing just before diabetes. If it's 100 to 110, you're in the gray area. Okay, if it's 100, you're normal. Now, if you didn't watch my other videos on what that means, that's 1 teaspoon of sugar per all of your blood. That's 1.5 gallons, or usually like between 1.5 or 1 1/3 gallons of blood. So that 1 teaspoon for that much blood is very diluted. That's not a lot of sugar. An average American consumes 31 teaspoons of sugar. The American Diabetes Association recommends, I think it's like more than that. It's like 52, if I'm not mistaken, teaspoons of sugar within all the food. Not added sugar, but if you add in all the carbohydrates and things. Now, when I get the feedback from a lot of people who are doing ketogenic diets, intermittent fasting, and they're doing very well with their blood sugars, it comes lower than 100. It's like between 70 and 86. I consider this normal. I would use these numbers, 70 to 86. That's a half a teaspoon of sugar in all of your blood. And I'm not talking about from the diet, you're consuming a half a teaspoon of sugar. I'm talking about your body's ability to make its own sugar. It's called gluconeogenesis. Your liver can make it out of your own fat or dietary protein. You don't need sugar, okay? So that's that piece of data. Now, you could still have normal fasting glucose and still have a problem with prediabetes if you have higher levels of fasting insulin. So like a fasting insulin would be 10, but there's a lot of people that have even 20, 30, even 40, which is very, very high, and have normal glucose because it takes time for it to show up in the glucose in the blood, but it's happening throughout the body. It's happening with insulin. So you have insulin resistance at the cellular level, and then it gets worse, and then it starts to affect the blood sugars, and then it creates more of a problem. So if you have normal fasting glucose, that doesn't mean you don't have insulin resistance. You would want to check your fasting insulin test to see what that is. The point I'm trying to make is that you want to not rely on one test. You want to take several tests to really determine if you have this. Of course, you want to look at the symptoms too. Do you crave sweets? Oh, that's a problem. If you can't go from one meal to the next, that's a problem. If you get sleepy after you eat, that's another problem. That's all insulin resistance. So a tingling in the fingers, numbness in the hands, that's all prediabetes or diabetes. So just don't go by one test. Then you have A1C, which again is an okay test, but there's variables that sometimes are not as accurate because it could be other factors relating to that, especially if they do the test and you're stressed, or you drank coffee, or you're dehydrated, or you exercised the night before, or you didn't sleep. All these factors can affect the time that you took the test. So again, take multiple tests. But the American Diabetes Association says you should be below 6. Well, I think they recommend that because the amount of carbohydrates they're recommending, they're never going to get it down below 6. I recommend 4.6 to 5.3. That would be a normal. Okay, you want to keep it even below 5. A really good test would be the post-meal glucose test. All right, so you just check your blood glucose 2 hours after a meal and use a glucometer, which is basically a glucose meter, and it should be like less than 120. Of course, the American Diabetes Association said it's normal if it's below 140. Okay, but again, because they're recommending so many carbs, they're raising the values there. So the point is that you would want to get it down below 140. That's a good test. So if you were to test all these, you have a real good indication to see if you have diabetes or not. So anyway, thanks for watching. Put your comments below. Hi guys. Hey, listen, I created a pretty amazing evaluation quiz down below that actually analyzes your symptoms to find the cause, the root cause of all of your symptoms, the most likely cause. So take the quiz now, and we'll send you a report.